Hi, my name is Renee. I'm a student at UDC and I'm recording this video for my oral communications class in reference to the COVID-19 virus. I work at Children's National Medical Center, and the COVID-19 virus has caused us to set up some new guidelines for safety. As we know, COVID-19 has become a pandemic here, a pandemic around the world, and here in the District of Columbia, we have well over 1,000 people that have passed away due to concerns of this coronavirus. So Children's has become one of the hubs for intake for coronavirus. We've changed our guidelines to accepting young adults up to age 29. 29 years of age. This will help alleviate some of the pressure from the neighboring hospitals because there's an overload of cases. Children's alone has over 30 cases of positively tested coronavirus cases. So some of the other guidelines that we have set in place are new visitation guidelines. So we are only allowing one parent per patient to visit inside the hospital, inpatients, and to bring their kids even to outpatient clinics. We are not taking any surgical candidates. We're only doing emergency surgeries. So we're limiting those procedures that will be done here at the hospital. Entrance upon the hospital. As employees enter the hospital, we are being tested. We're not being tested for corona, but we're having our temperature registered to ensure that we don't have any viruses, or we're not carrying any flu or high grade fevers. If so, then, we'll be sent home. We are also issued masks upon arrival. All patients coming into the hospital are being tested for their temperature, and they are also issued masks so that they can come into the hospital. Children that will be staying overnight for any overnight visits, they are being tested in advance. We're asking them to come the day before and be tested for the virus, or arrive at least 3 hours early for your admission, because the test results can take up to 6 hours to come back. And if you've tested positive and you're coming into the hospital, you will be sent home unless you are at the point where you have to be admitted, but you will not be admitted for the purpose that you came in if you're tested positive upon arrival of the hospital. We are also setting up where we have set up assistance for our employees who are struggling, or who are stressed or anxious, or nervous about this virus and the effect that it has on our personal lives and on the lives of our family members. So our occupational health unit and our employee assistance department has put together longer extended hours to allow those to come in and talk about what's going on. If you are an employee and you are not doing direct patient care, for example, even environmental services or food service workers, and nurses, techs, respiratory, and doctors, we all are now working. If you're not in that category, then you are allowed to telework. That's a new guideline that the hospital has established to allow the people to stay away from, or not be so exposed to the virus. So I think that Children's is doing a great job with trying to maintain the spread of the disease. There are other hospitals. I talked with an employee at Georgetown Hospital, and she sent over some of their guidelines, and they too are testing people before you enter the building. They're testing their employees, and they're testing the patients, and their housekeeping or environmental service units are really doing a great job with sterilizing and keeping the building safe and clean. I think everybody at this point is doing their part on trying to deviate the spread of this virus. So I think we should all take this thing very seriously. If you have a fever or you're not feeling well, don't go outside. Don't go to work. If it's not absolutely necessary, try to stay in. Keep your hands clean. Keep your mask on. And if you feel sick, isolate yourself from your family members that you won't spread this disease. I think we're all in this thing together, and we're all going to fight this thing together, and we're going to do the best that we can to annihilate this disease. So thank you so much for your time. I appreciate it. Have a great evening. Bye.